Good morning, everyone. Welcome to today's session on infection control. Infection control is one of the most important responsibilities of every nurse. Every time we provide patient care, our goal is not only to treat the patient, but also to prevent the spread of infection. By following simple infection prevention practices, we can protect our patients, ourselves, our colleagues, and visitors. Let's begin by understanding the most effective method of preventing infection. Hand hygiene is the single most effective way to prevent the spread of infection in healthcare settings. Our hands come into contact with patients, equipment, and different surfaces throughout the day. If we do not clean our hands properly, harmful microorganisms can easily spread from one patient to another. For this reason, hand hygiene should become a routine part of every patient interaction. There are 5 important moments when hand hygiene should always be performed. First, before touching a patient. Second, before performing a clean or aseptic procedure, such as wound dressing or catheter care. Third, after exposure to blood or body fluids. Fourth, after touching a patient. And finally, after touching the patient's surroundings, such as the bed rails, bedside table, or medical equipment. Following these 5 moments helps reduce the risk of healthcare-associated infections. When should we wash our hands? There are situations where washing hands with soap and water is necessary. Wash your hands if they are visibly dirty or contaminated with blood or body fluids. You should also wash your hands after using the toilet, before preparing food or medications, before putting on gloves, and immediately after removing gloves. When caring for patients with Clostridioides difficile or norovirus, always use soap and water because alcohol-based hand rub is not effective against these organisms. There are 2 common methods of hand hygiene. The first is hand washing with soap and water, which usually takes 40 to 60 seconds. The second is alcohol-based hand rub, which takes about 20 to 30 seconds when the hands are not visibly dirty. No matter which method you use, make sure you clean every part of your hands, including your palms, the back of your hands, between your fingers, your fingertips, your thumbs, and your wrists. Always allow your hands to dry completely before touching the patient. While performing hand hygiene, remember these simple points. Turn off the tap using your elbow or a clean paper towel whenever possible. Do not touch the waste bin with clean hands. Dry your hands thoroughly using a single-use towel. And most importantly, remember that gloves never replace hand hygiene. You should always clean your hands before wearing gloves and immediately after removing them. Now, let's discuss antimicrobial resistant organisms, also called AMROs. These are bacteria that no longer respond to antibiotics that previously worked well. Because of this, infections become more difficult to treat. Some common examples include MRSA, VRE, ESBL, and CPE. These organisms are often called superbugs because they are resistant to multiple antibiotics. Preventing superbugs is everyone's responsibility. Use antibiotics only when they are really needed. Avoid unnecessary or prolonged use of antibiotics. Maintain good personal hygiene and excellent hand hygiene. Use appropriate isolation precautions whenever required, and always wear the correct personal protective equipment based on the level of risk. By following these simple measures, we can reduce the spread of antimicrobial resistant organisms. Personal protective equipment, or PPE, helps protect healthcare workers from exposure to infectious materials. Common PPE includes gloves, gowns, masks, respirators, and eye protection. However, PPE should only be used when necessary for the task being performed. Choosing the correct PPE depends on the patient's condition, the procedure you are performing, and the risk of exposure. Before every patient interaction, nurses should perform a point-of-care risk assessment, also known as PCRA. Ask yourself a few simple questions. Does the patient have symptoms of an infection? Will I come into contact with blood or body fluids? Am I performing an aerosol-generating procedure? Do I need gloves, a gown, eye protection, or a mask? By taking a few seconds to assess the situation, you can choose the right precautions before providing care. If you enjoyed this video, don't forget to subscribe and hit the bell icon for more nursing updates. Want to learn more about infection control? Join Xfini Academy today. Our contact details are in the description. Thank you for watching, and we'll see you in the next video. Goodbye.